exciting stuff. So what is Medicare? Medicare is health insurance for people 65 or older, people under 65 with certain disabilities, or people with end-stage renal disease. So touching on the other two topics, because someone 65 or older, that's pretty common knowledge. We all know that. So someone with under 65 with disabilities, usually they have to be on disability for 2 years to become Medicare eligible. Not all companies offer supplements for under 65. So if you have a case where someone's asking you about this and they're not in that 65 or older age bracket, definitely call us. We can do some digging to see what companies are going to be available for the client. These rates are usually higher than a 65 or older person, so you will run into that as well. And then for end-stage renal disease, Medicare does have special insurance for these specific cases. Now, the parts of Medicare, you have three main parts. You have your Part A.
Oh, I'm sorry.
You're okay. I just want to make sure that we're caught up here. Okay, so you have your Part A. It's your hospital insurance. So this helps cover inpatient care in your hospitals, including critical access, skilled hospice care, some home health care. The Medicare beneficiaries must meet certain conditions to get these benefits. Most people do not pay for their Part A because themselves or their spouses already paid for it through working. The next part is your Part B. This helps cover doctor services, outpatient care, some physical and occupation therapy, and some home health care as well. There is a premium on this of $135. Typically it comes out of your Social Security, or it will be billed quarterly. And then you have your Part D, your prescription drug plan. So this is required to get when you get on your Part A, and if it's not, there could be a penalty. We'll look in that a little bit deeper, but I just want to touch back on that Part B. A lot of you might have higher net worth clients, and I'll let Alyssa get into this a little bit, but their Part B premium can vary depending on their income. So Alyssa, if you want to get into that a little bit.
Yeah, I think this is a really good opportunity when you're doing your holistic planning with your clients. It's just a good value add. Most people don't really understand that their premium can fluctuate. This happened several years ago and significantly affected my clients, and I'm sure has yours. Again, most people are just paying it out of their Social Security. Let's pretend their Social Security check is $2,000 and, they have a big income event. Now, all of a sudden, their Social Security check has gone down to $1,500 and they're asking you why. Now, you'll kind of have a base knowledge that it probably has something to do with their Part B premium. Again, this is a way you could introduce Medicare to your clients, is just your deeper understanding for it. Maybe when you're doing income planning for a client that has sold a farm or has a large capital gain. It is also a great way for you guys to discuss the value of tax management. Taxes affect so many things, and including Part B premiums. And so again, it's just a value add, and it's really good to understand. I know these incomes seem high, for example, but I think I have a couple clients a year that have, the ability or decide to sell a farm and have a large cap gain because of that. And all of a sudden, for the following 2 years, their premium jumps from $135 to $460 a month. That's a pretty significant change in expenses. And so you're going to, want to be aware of that. So I just wanted to make sure we pointed that out. You can get this exact slide on the Medicare.gov website. We actually have one in our office, just so if a client comes in, we can have this discussion. It's also really nice to know if you have a prospect come in and they tell you they're paying, $352 a month for their Medicare Part B, they're in a pretty high income earning bracket, and it's probably a really good planning client for you as well. So it gives you some insight into their net worth as well.
All right, great. Next, the Part D penalty. So we just touched on this a little bit, but when someone enrolls in their Part A, usually they'll get on a Part D, not all the time, but if they do not get on a Part D, when they got on their Part A, they could have a penalty. So the late enrollment penalty depends on how long they went without Part D or another credible prescription drug coverage. And Medicare calculates this penalty by multiplying 1% of the national base beneficiary premium times the number of full months that they did not have credible coverage, and then of course rounds it up. So for example, if someone went a full year, 12 months without Part D, they would have a 12% penalty on the national base premium, which this year is $33.19. Rounded up, that's $4. They would pay that $4 in addition to whatever plan's monthly premium every single month for the rest of the time that they are on that Part D. So if they have a $10 plan, they're paying $14 for the rest of their time. One of the ways, so someone that's maybe on a lot of prescriptions and they're asking, why do I need a drug plan when I don't have any drugs I take? One of the ways is just go with the cheapest plan and then visit with the client annually, and they can get that changed around. Part D plans aren't one that we're doing at this time with this group, so you can always find someone that maybe you can partner up with that does all their certifying and testing for this as well. And that leads perfectly into the Medicare Part C. So we have gotten some questions on this already. Your Medicare Part C is also called Medicare Advantage. They are administered by private insurance companies contracted with Medicare. It does cover everything that Part A and Part B cover, and it might have some additional benefits as well, including some prescription drug plans. But one thing to really think about with these is that there's additional certifications that need to be completed every single year. You have AHIP training that needs to be done every year, and then you have to certify with every single company every single year that you want to offer in order to keep your income, in order to keep offering them. These are non-standardized, and again, lots of training, and they, as I said, contract with Medicare. They have a year contract, so, and they are per county. So one year, they could be in your county. The next year, they could pull out of that county, leaving those lives uncovered that have to scramble and change to something else. So there's a lot more work that goes into them. Again, this isn't one that we are tackling at this time with this group, just because there's a lot more footwork with them. So we would strongly recommend, if you have clients asking about Advantage plans or they really want an Advantage plan, see if you can find someone that can partner up that already has those training and certifications done.
And I can just chime in here. It really just depends on the areas. For you advisors that may be in more urban areas, larger population areas, there's usually a little bit more higher concentration of a Medicare Advantage plan offerings. You'll want to try to find, more information, and Sassy will get into, we have some resources for you. If you're in a smaller rural community, for example, Fort Morgan, Colorado, there is no providers in Fort Morgan. And so if you have a client that has a Medicare Advantage plan, they're traveling to Greeley or to Denver to go see a doctor that is covered in their network. And so more of the rural, non-concentrated areas are really not going to be a Medicare Advantage market. However, there are certain pockets, so you're really, just going to want to do some research. My biggest thing, we'll go through this when we do the Medicare map, how you're really going to talk about it with your clients. We'll go into this a little bit more so you can have an educated conversation with your client. And then again, just to reiterate what Sassy said, if you feel like you have an area where you do have people more concentrated in Medicare Advantages, try to find a partnership, because I don't think the income and the amount of work and customer service that goes with Advantage plans is going to make sense. It's really going to probably take you away from, your bulk income producing activities instead of complement like the traditional Medicare supplement does.
So one of those tools that we will offer you once you're contracted are landscapes. We have it for Advantage plans, drug plans, and I believe special needs plans as well. But the Advantage plans, this is an extremely helpful tool, especially when you're dealing with areas that are large MA Medicare Advantage spots. This has every single state, every single county, every single plan. Right now for 2019, the 2020 ones will get probably early October. But this tells you every single thing that you need to know. It tells you the type of plan. It tells you the premium that the client can pay. You'll notice a lot of these are $0 premium, but you honestly get what you pay for. And the prescription drug benefit, it tells you in-network, maximum out-of-pocket. Those are the things that you're mostly going to be looking at. So when someone wants one of these, you can look at this chart and do the math for them, see that their maximum out-of-pocket, if something happens, they might be paying way more than what they paid annually with getting on a supplement. And with a supplement, so long as it's a Medicare-approved charge, it's going to be covered.
I think almost all of them, if they have something happen, then their out-of-pocket maximum is going to be higher than, what the traditional supplement with full coverage is. And again, the other thing you have to remember with traditional Medicare is that as long as the provider accepts Medicare, your client can go to that care. And so, almost 95% of all physicians, all hospitals accept Medicare. And so, if they vacation in Florida, they can go to a doctor down there, or if they're on vacation visiting a child in Georgia and they get sick, they don't have to worry about, oh no, now I'm out of network. It really just takes the stress off of them to go on the standardized side of Medicare. So anyway, but these landscapes are extremely helpful, especially if you start to get those questions, because then you can seriously just look at, okay, they've got the Blue Advantage complete. The out of pockets for, $5,000. Maybe you discuss what the benefits of switching to a supplement during that open enrollment period, which is a great way for you to go to your next slide, Sassy.
That's right. So now we've got the basics of Medicare, and now we've got to go into our enrollment periods. This is where we see a lot of confusion. There's quite a few enrollment periods, so I definitely understand why it can get confusing. The first one is the initial enrollment period. So this is when someone is very first eligible for Medicare. You have a 7-month period to sign up for Part A and or Part B, depending on if you're retiring at that time or not. So, for example, eligible when you turn 65. The period starts 3 months before you turn 65, the month that you turn 65, and then 3 months after you turn 65. For supplements, this is considered open enrollment. So at this time, you go through no underwriting. Any company that your client wants to go to, they can sign the application, pay the premium, they've got it. There's no health questions involved there. So those are usually the easiest people to get in, because it's getting issued, you're getting paid. The next one is a special enrollment period. So this is once your initial enrollment period ends, you have a chance to sign up during the special enrollment. If you're covered under a group plan or current employer, if you're coming off of those, is when you can sign up. So this is an 8-month period. And again, sign up for your Part A or Part B the month after employment ends or after your group health plan ends.
And if I just can take, again, just a few minutes, just a specific, we have a lot of clients that are now working past the age of 65, we know we're doing their retirement planning. We know they're planning on retiring at 68. And so they're on a group health plan with the company they work with. So you just want to make sure that, you educate them on the special enrollment period. Again, that they won't have any health questions to get into Medicare and the Medicare supplement. Usually you want to try to make sure that there's no gap in that coverage, so you're going to want to start working with this and them a few months before they actually are retiring, to make sure that when their group health plan ends, their supplement and Medicare starts. But the beauty of it is, even if they're in poor health, maybe that's the reason why they're retiring, that open enrollment period, again, there is no health questions. So it's a very significant period, an opportunity for you to really help them out. And it's very, very confusing. They're all very confused about it. So it's not that hard once you kind of do a few of them, once you talk about it with a few clients, but it's important to remember.
So the next open enrollment period, or annual enrollment period is typically what we call it, is for your Medicare Part D. This is what we're getting into. This is a great time of year for you guys to start entering this market, because a lot of seniors are a little confused this time of year, thinking that this is the only time that they can switch some stuff around. So it should drive your business activity up as well. So annual enrollment period, sometimes also called open enrollment period, is October 15th through December 7th. Again, this is only for your Part D and Advantage plans, not the supplements. This is when you can change from original Medicare to an Advantage plan, from one Advantage plan to another Advantage plan, or back to original Medicare. Maybe one Advantage plan doesn't have drug coverage, you want one that does have drug coverage, you can change that. Or you can change your Part D, your drug plan, to another Part D drug plan. Or you can drop your drug plan. Don't recommend it, but it is the time of year that if any changes need to be made, October 15th through December 7th is the time to do it. There is one more, and this is the Medicare Advantage open enrollment. So I'll definitely see where all these terms get a little muddy. But January 1st through March 31st is when you can change your Medicare Advantage stuff around again. So again, you can change from one Medicare Advantage plan to another that does or doesn't have drug coverage. You can disenroll from your Medicare Advantage plan and return to original Medicare. And if you do that, you'll have the option to join into a Part D plan at that time as well. And if you enrolled into an Advantage plan during the initial enrollment, you can change to another plan, as I said, with or without drug benefit within those first 3 months. So with that, I think I've gone over enough. Hopefully didn't confuse anyone too much there. I'll hand it off to Alyssa.
Okay, and I do have everybody on non-muted. Do we have any questions up to this point before we go on?
Can you go back to the previous slide before this one, the enrollment, please?
This one?
Yes.
Yeah.
I just wanted to grab a couple notes. Thank you.
Yeah, and we're going to be sending the entire presentation out to you after, because it will be a good resource for you. The biggest thing that we see in our office is the drug plan to drug plan. You know, you've got a client who is on a basic drug plan and then has something happen to them, and now they're taking a very expensive inhaler that's not covered by the drug plan. It's a very simple process, but this is where maybe some volume will come in when they're asking you a little bit of guidance on drug plans. Most of our clients are pretty technically savvy and can go directly to the Medicare.gov website. They enter their drug information and they're able to switch right online. And I found that most of my younger Medicare recipients now are really just doing it on their own. But I think it's good for you to be aware of it so that you can kind of stay in touch with that. But great information is to have kind of at your fingertips. So one of the beauties of the Medicare supplement world, the traditional Medicare side, is there is no open enrollment period to switch existing policies. So we've got your initial periods where either they're 65 or they're retiring from a group plan. That's where you can do enrollments without any type of underwriting questions. I did several of them this week. I mean, it's so simple. You don't even ask any health questions. You literally are just showing them the best price plans out there, and you're signing up and getting issued within days. But where the huge opportunity for you and your clients beyond that is, you've got your older clients who have been on maybe higher, more expensive plans, and during a review, you can discuss that. Have you seen your Medicare supplements go up in the last few years premium wise? And I would assume all of them are going to say yes. And that's where you can kind of, did you know we offer those services now? It's a great way, and you don't have to wait till a special time of year. You can do that really anytime. So it would be a very simple way to just start adding that conversation to your existing, meetings that you're having with clients. Because you don't have to really worry about those open enrollment periods or anything like that, because you can swap Medicare supplements throughout the year. So there is a lot to Medicare, but not really. I mean, once you have a few conversations, it's all standardized. And so we've discussed this in the past, but we are going to provide you with a Medicare map to be able to have those conversations with the client. And we just wanted to reiterate to you right now that Medicare supplements are all standardized. A Plan F with Blue Cross Blue Shield is the same as a Plan F with Mutual of Omaha, which is the same as a F with Aetna. They can't pay any different. One question I had from a client the other day is, for example, AARP's United Healthcare Plan, they give a free Silver Sneakers membership. It's some side membership thing they have with Silver Sneakers. That membership costs about $200 if you were to just go to Silver Sneakers and get it. And so she goes, all of my friends have that, why don't I have that? Why do I have to pay for it? And I just simply pulled up the CSG software and said, well, they're paying $1,600 more a year for their Medicare supplement to have a $200 Silver Sneakers a benefit. So anyway, that CSG software can really help you, but all the base benefits are standardized on the Medicare supplement side. The most popular plan that we see being issued is the Plan G. The only thing that the Plan G does not cover is the Part B deductible. The Part D deductible is only $185 per plan year, which if you've got someone retiring now, they're probably coming from a group benefit plan that have a $6,000, $7,000, $8,000 annual deductible. So they're usually willing to take on a small amount of deductible. And normally those premiums are $300 to $400 less a year than the Plan F that covers the deductible. So some simple math and education for your clients can point them in that direction. The Plan M is, I don't personally use that, but there is some agents that use that. It just gets a little bit more confusing when it comes to doctor visits. You have co-pays and things like that, but it is a lot cheaper. So, for someone that's really, really price sensitive, we can discuss that with you. So going back to that, the Medicare map, again, we're going to provide this with your logo, etc. After contracting is completed. This is a great way for you to walk your client through educating them on Medicare. It also is a nice little reference for you, so you're not having to try to memorize everything that we've talked about today. And so, you can have some of these simply printed and in your room where you meet clients or available to you, however, is most convenient for you. And you can talk about Part A. You can see these lines on here, and then you can simply put the letter F or the letter G example and saying that they cover those copays for you. It's just a great way to educate your client on it, and we did this in the last webinar series we had. It's also a great way you can collect information if they are currently on Medicare to give you the opportunity to discuss what they currently have. It also does give you information on Part C. Talk to them about that if they have a Medicare Advantage plan, and just hit on the highlights that we talked about earlier with Sassy, that it's not original Medicare, that it's like a network plan. Usually there's co-pays at the doctor and office. And the biggest thing is that the plan availability benefits do change annually and can become really complex for the clients that have those. So they're going to ask you questions about this, especially during the AEP season coming up. You're going to be seeing a lot of Humana advertisements on the television. This is normally what they're talking about, so it gives you a little just base knowledge. Again, the Part D is something that you want to encourage your clients to get on. Like Sassy said earlier, if they don't do it during their initial open enrollment period or special open enrollment period, they're going to get penalized for life, which can be pretty significant. So through some education through the Medicare.gov website, again, you can give them that information that they need. Switching gears, again, just wanted to revisit this, making sure that for those of you who have gotten contract already, the CSG quoting tool is your friend. It gives you everything that you need to figure out what's the most competitive products in your area. And so it also has a lot of underwriting filters that you can add. I don't do that. I just call Sassy or Cassie and they do it for me. For example, I just had a client in. She is a high net worth client, but still wants to save money. We're able to switch her supplement and save her about $1,500 a year. And she had 4 medications. So I just told the client before I submitted the application, I would have our pre-underwriting team look at it. They gave me the green light that we're good, so I sent the application in. It just saves you a step. Send those applications to us first. We can say, hey, it looks like they're on 3 blood pressure medicines. It's not going to work. Again, don't have to try to memorize all those things. But if you are hands-on and want to look at those underwriting filters, the CSG software does have that for you. The quoting tool is really, a way for you to create pieces. You can have your staff do that for you. You can show them that you're shopping for them, not selling them anything, etc. If you click on the plan details, it's going to give you more information about, the specifics of the different companies we work with. Beyond that, one of the things that I use a lot is the bullet sheets that Sassy keeps updated. Those are even going to go into more detail. For example, I had a client, in a few days ago, couldn't remember what the household discount rules were for a specific company. Right there on the bullet sheet, oh yeah, they just have to live with someone over 18. Boom, I got them the discount. So we're trying to provide you all the tools so you don't have to try to memorize all these things. And again, not spend too much time outside of your normal practice and development, but yet still add a significant value. You can add we can do some individual training on this too if you feel like you really want to dive into that. It is a great opportunity. The 3rd page of that Medicare map also talks about non-covered Medicare benefits. Honestly, I have never personally sold a dental vision hearing. There's a new one that just came out that's a little bit interesting to talk about, but our new boomers retiring are used to having some type of dental vision and hearing. They want to have the discussion. You just need to tell them that Medicare doesn't cover those things. Do they feel like they want to self-insure, or do they want to look at some options? Again, some of the companies that you're already contracted with do have a dental vision hearing, or DVH is what we call them. And it's a very simple type of plan. So if you get somebody that's interested, just call us and we can walk you through the plan options. Again, I think it's better just to say, hey, we've got knowledge, you've given them that, so they don't go to the dentist the first time and realize that Medicare is not covering it. Final expense, again, Medicare is not in that business of providing any type of life insurance or death benefit. They provide an extremely small $255 Medicare death benefit to the family, which obviously isn't going to do much. So it's a great way for you to open up conversations for cross-selling life insurance, talking about maybe current policies that they have and what gaps you might be able to cover or review for them. Those are things that the agency also is going to be able to offer to you. But again, just a way for you to make some notes and get to know your client on a better level. And then, of course, the dreaded conversation about long-term care insurance or extended care. I think it's a very underutilized insurance. It's very hard to talk about with your clients. This is a way very softly to mention it. I would assume 90% of your clients have had some experience with their parents or something involving that, and they should have a conversation. Again, it just helps you to understand them as a financial client. And again, just make some notes for further conversations when you have more reviews with them down the road. So I know, again, this tool we're really proud of. I think it'll really help you integrate this without, having to reinvent the wheel to start talking about this with your clients. So I'm going to switch gears just really quick. I just got something in the mail on this. Medicare is making some changes in 2020. We've discussed this in not a lot of detail in our few previous webinars. MACRA 2020 is happening. It's the final stage of this Medicare Access and CHIP Reauthorization Act of 2015. Okay, great. What in the heck does that mean? Well, it means that all of our seniors are confused about it, but it's very simple. For those turning 65 after January 1st of 2020, they will no longer be eligible for enrolling in the Plan F or Plan C. So again, I talked to you about that earlier. That Plan F covers everything, including that Part B deductible. The Plan G does not. So your newly 65 or newly eligible will not have the Plan F to them. I just received this in the mail today or yesterday, and I wanted to show you what your clients are receiving. I don't know why I got it. I'm not quite Medicare age, but it says recent legislation passed by Congress may result in substantial changes to your 2020 benefits, including Medicare and changes to your current healthcare coverage. These changes directly impact Medicare beneficiaries. You know, and it just like scares the seniors. And so you might be getting calls about that. It really doesn't substantially change anybody's coverage. It doesn't change anybody's existing coverage. It truly is only affecting those new onto Medicare after next year, where they're eliminating the Plan F. So, but they are getting hammered with calls and getting scared. And so I think congratulations for taking the step to get involved in it, because they're going to be turning to you and asking you advice on it. And now you can really just tell them specifically. We have this, we can design this. If you feel like you've got an engineer type client who really wants to know more about it, we can put your logo on here and provide this so you'll have it for your clients. Any questions up to this point? We're getting close to being done. Okay, so again, we do have our frequently asked questions that we'll send out after this presentation for the MACRA, but keep it simple. It doesn't affect anybody already 65. It only affects those turning 65 or in special open enrollment periods starting next year. And again, just remember, it does just eliminate the Plan F. So this is the new outline for 2020. This is something Tate's going to customize for the back of that Medicare map. So because, you know, we're getting close to 2020, you know, you might not want to print too many of them out and wait, and we'll have one updated soon for the 2020 outline for the back of your Medicare map. So with that, Chad, I'm going to turn it back to you, okay?
Thank you, Alyssa. Thank you, Sassy. Listen, before I kind of wrap up the presentation, are there any questions for Sassy or Alyssa? I know we covered a lot of information. We will forward this presentation out to everybody, but if there's a question, go ahead and ask it now before we wrap up the call. And again, Sassy and Alyssa are both here as a reference point. So if there's a question, go ahead and ask it. If not, we'll wrap up the presentation. Okay, I'll assume that's no questions. So listen, as we wrap up the presentation, here's the contact information. Again, we're going to send this out to everybody. Couple points just to bring up to speed with everybody. One of the reasons why, I mentioned these in our previous calls, but one of the reasons why we chose Axford to be our partner in the Medicare supplement space is they clearly have the expertise. They have the support for us. Every one of these contacts that you see here on this page, they're all here to help you. And I mentioned that I'm here and Kelly is here to help, but Axford is definitely here to help out through the contracting process, through any type of questions that come up. And there are going to be questions that come up when you start talking with clients about Medicare supplements, but they're here to support every effort that you have. So make sure that you leverage what we have available for us, whether it's using them as a direct phone call or an email, whatever it is, please use them as a support mechanism. I want to say thank you to Sassy and to Alyssa for making the time. I want to thank everybody who joined us on the call today. We will be sending out follow-up emails and with this presentation, but also for our next wave of calls, we're going to do a deeper dive into the marketing that we have available and how we can customize that and how we can make it with your DBAs when you want to get down that process of actually starting to sell Medicare supplements. I mentioned this in the beginning. Please do what you can to either amend your OBA if you haven't done it or submit your OBA, because we can't move forward until that has actually been approved with LPL. With that, I'm going to wrap up the call. Thank you for everybody for making the time. Be on the lookout for future emails. And thank you to Axford, Alyssa, and Sassy for making the time to join us this morning. Thanks.
Thank you, guys. Have a great rest of your week.
Thank you.